13-year-old male presents with left hip pain. I'm showing you the frontal radiograph of the pelvis. Describe the findings.
All right, let's take a look. The antero-posterior pelvic radiograph demonstrates an unfused skeleton with abnormalities isolated to the left hip. There is widening and mild irregularity of the left capital femoral growth plate. Additionally, there is a slight decrease in the vertical height of the left femoral epiphysis compared to the normal contralateral right side. This apparent reduction in height suggests posteromedial displacement or slipping of the epiphysis. Klein's line, drawn along the superior border of the left femoral neck, fails to intersect the epiphysis, whereas it intersects the right epiphysis normally. The findings are consistent with a slipped left upper femoral epiphysis.
I am showing you two more images, the same AP film with lines drawn and a lateral hip view. Describe how they help confirm the diagnosis.
The first image shows Klein's lines drawn along the superior margin of the bilateral femoral necks. In a normal hip, this line should intersect a portion of the lateral femoral epiphysis, as seen on the patient's right side. On the left, the line runs entirely superior to the epiphysis, confirming posteromedial slipping. The companion frog lateral projection of the pelvis accentuates the slip, making the posterior displacement of the left femoral head much more obvious. It also allows us to carefully evaluate the contralateral right hip for any subtle early slip.
Explain the epidemiology, clinical presentation, and pathophysiology of this condition.
Slipped capital femoral epiphysis is the most common hip disorder in adolescents, typically affecting overweight boys during their growth spurt. The mean age of onset is 13 years for males and 11 years for females. Pathophysically, it represents an atraumatic fracture through the hypertrophic zone of the physeal plate, caused by increased shear forces during rapid growth. Patients typically present with groin or thigh pain and a limp, but a quarter of patients present only with referred knee pain. The disease is bilateral in approximately 20% of cases.
What are the typical radiological features to look for on plain films, and why is a lateral view mandatory?
Radiological signs on the AP radiograph include widening of the physis, subluxation, and Klein's line failing to intersect the epiphysis. However, these findings can be extremely subtle on the frontal view, especially in early or mild slips. A frog lateral projection is mandatory because the epiphysis slips posteriorly and medially, meaning the slip is often seen first on the lateral view. Relying solely on the AP view can lead to a delayed diagnosis, increasing the risk of severe complications.
Discuss the potential complications, treatment options, and how you would manage this patient as a radiologist.
The most severe complications are avascular necrosis of the femoral head and chondrolysis, which lead to premature osteoarthritis. The risk of avascular necrosis increases with unstable slips or delayed surgical stabilization. Management requires urgent orthopedic referral for surgical pinning of the epiphysis in its current position to prevent further slip. As a radiologist, I would immediately contact the orthopedic team, advise non-weight-bearing status for the patient, and suggest prophylactic pinning of the contralateral hip, if indicated.